I'm going to give you all a minute. You're getting connected still. Starting to see the faces pop up on the screen as they connect. Good to see you. Hey, David. Love to see everyone today. Happy, I guess it's Tuesday. It's hard to keep track of the days. I don't know if the time change has kind of confused anybody, but it has me this week, so I'm still getting adjusted. So welcome everyone to our program today. This is the last in our series that we did in partnership with Amneal. And today that we're going to be focusing on the care partners and their experience with OFF. And that is not only like understanding what OFF is, but also how to help their loved one articulate those experiences to their physician. So we're going to get started and I'll introduce our speakers today, but I want to just go ahead and ask you to open up your chat box, and that is where we're going to have you ask your questions. We will ask those throughout today. And give us a shout out. Let us know where you're joining us from, because we love to see where all of our attendees are from. And in the meantime, I want to introduce our two speakers. So with us today is Dr. Pinky Agarwal. She's a board certified neurologist at the Booth Gardner's Parkinson Care Center and chair of medicine at Evergreen Medical Center in Kirkland, Washington, and clinical professor of neurology at the University of Washington in Seattle. She's fellowship trained in movement disorders at the Neurological Institute of Columbia Presbyterian Hospital in New York City. And she's been principal investigator or sub-investigator over 200 clinical trials and has authored more than 50 peer-reviewed publications. And then also with us today is Greg Chesmore. So Parkinson's disease became a part of Greg's life about 12 years ago when he met his partner Chad in 2009. Chad was diagnosed with Parkinson's at age 33 and has been living with the disease for 18 years. In 2013, Chad underwent deep brain stimulation surgery, and Greg and Chad have been part of the Parkinson's community in Wisconsin for more than a decade, serving in board roles, hosting various fundraisers. And in their family, they have a 13-year-old son, Jordan, two Great Danes, Penelope and Titus. I love Great Danes, just the best dogs. They split their time between Madison, Wisconsin and Napa Valley in California. I'm very jealous about that. And in his professional life, Greg is a vice president of governmental affairs for a biotechnology company. So welcome to Greg and to Dr. Agarwal.
Thank you.
Thank you.
All right, so today we're going to be again talking about Parkinson's symptoms and the experience of the presentation of OFF. And a lot of times we talk about this from the person with Parkinson's perspective, but today we want to look at this from the care partner's perspective. And OFF has many different types of presentation and degrees, and sometimes it's difficult for people to articulate what exactly is going on, not only with their significant other, but also maybe with their physician. So we're going to talk a little bit about first what types of OFF there are that you might experience or your loved one might experience. And then we want to talk a little bit about the actual life experience of having a loved one with OFF. So I'm going to start first with Dr. Agarwal. If you could talk a bit about the types of OFF that people might experience.
So first of all, what is on and what is off? So, you know, in Parkinson's, when one of the top medications to use is carbidopa levodopa. And one of the challenges with carbidopa levodopa, it's short acting. So what can happen sometimes is that people take the medication and they feel better. So the medication kicks in approximately half an hour, and then they have improvement in slowness or stiffness. Their gait becomes better. Sometimes the swallowing is better. Overall, they feel better. But then, and so that time when the med is working is called on time. Now, sometimes people will notice that, well, it's before it's getting time for the next dose, the med starts running out of their system, and then their Parkinson's symptoms come back. So the tremor, the slowness, stiffness, shuffling might come back. So this time when the meds are not working is off time. So meds working on time, meds working off time. The times when people can have off are one, early in the morning when they wake up, because they may have taken the last dose, say at bedtime. And when they wake up in the morning, it might be hard getting out of bed, getting down and walking to the bathroom. They may find they're slow and stiff. So that's morning off time. Some people will have what's called delayed on, meaning, most of the times their carbidopa say kicks in half an hour. But if they've had a heavier meal, or they've been kind of sitting, or, atypical diet, maybe they ate some, little heavier food, they may find that when they take their medicine, it takes longer than the typical time to kick in. So instead of half an hour, maybe it'll take an hour. So that is called delayed on. Some people will have what's called a no on, or a dose failure, meaning they take a pill, but it's like it never kicked in. So they might wait, they've taken a pill, they wait, okay, in half an hour, I can expect to feel better. I can expect my walking to improve, but it never kicked in. And oftentimes that could be due to unpredictable absorption through the GI system. Again, if one takes it with a heavier meal, it's more likely to happen, but it can happen due to other reasons too. People can have what's called end of dose wearing off. Now that's quite a very typical wearing off symptom, where it's happening right before the next dose. So if you are taking the pill, say 5 hours apart, you might find that it's running out at 4.5 hours. So that's end of dose wearing off. And then sometimes, rarely, people will have sudden offs. Sudden offs meaning it's like turning off a light switch. Instead of gradually going from on to off or off to on, suddenly it's like it's like flipping from one state to another, and that's called a sudden off. And again, a lot of the times it can be due to unpredictable absorption of the carbidopa levodopa. The carbidopa levodopa does get absorbed in the intestine, not in the stomach. So how the med gets absorbed can be influenced a lot with what food one's eaten, or just if one has some protein, or even just a heavier fatty meal will delay the absorption. So that was the long answer to what are the kinds of off time.
Actually, that was a very succinct answer to that. So I have a question. So at what point do people typically start to experience off? I know it varies from person to person, but is there like a general rule?
On average, I would say about 50% of people at 5 years may experience off times.
And so on the flip side of that, I wondered if for just a minute you could talk about dyskinesia, because there's that balancing act between managing off and then trying to manage dyskinesia.
So dyskinesias are, they are, and if you can see me on the camera, you can see sort of little wiggling movements, more like dance-like movements. It can be easy to confuse tremor with dyskinesia. But one simple way of thinking about it is, if the movement is rhythmic, right, it's more likely to be tremor. If it's more dance-like, then it's more likely to be dyskinesia. Also, suppose you were to take multiple still photographs, right, of the movement, and they all look pretty similar, quite likely it's a tremor. But if you take multiple still photographs, they all look a little different, more likely to be dyskinesia. And basically, dyskinesia is almost like an overflow movement. So if someone's standing at the counter and say chopping, they might find like they're having a little truncal swaying, or just the neck might move. So it's more of an overflow movement. Instead of like making a little movement of the neck while speaking, now you have more of a truncal or a neck movement or a body movement. And oftentimes what will happen is people will have on time, which we discuss is a good time when the meds are working, off time when they are not working. And in between, there can be this on time with dyskinesias when the meds are working, but it almost looks like they're working a bit too well, so that there's overflow movements. So it can sometimes be challenging to, sometimes if you give more meds, it helps with the off time, but then sometimes you'll swing to the other side, which is the dyskinesia side. So that's a lot of fine tuning about what strategies to do. You want more on time, but you don't necessarily want more dyskinesias, or at least you don't want problematic dyskinesia.
And I think we'll talk a little bit more about treatments of those symptoms later on in the program, but really what we want to focus on is the care partner experience and understanding what's going on and being able to help their loved one articulate that. So I want to turn to Greg for a few minutes. And Greg, I would love it if you would share a little bit about you and your loved one, Chad, and maybe get into some of the experiences you've had with OFF.
Sure. Thanks. And thanks for having me. I think these conversations, particularly for care partners, are really important in our community. So I guess, preface it to say that, everybody is different. And on top of that, every relationship is different. So I think that one of the struggles that I've had over the past, decade, really, when we've really been dealing with the symptoms pretty heavily, was, at what point is it Parkinson's, and at what point is it just your partner's personality? Right? Because we have a tendency when Parkinson's kind of takes over our lives, even though I don't think that that's healthy, and we should all resist that and struggle against that. I do think that a disease like Parkinson's that is constantly manifesting itself in one of the partners, and your days sometimes become very unpredictable because of the disease, as well as the effects of the medication. I think it's important to really try to step back as much as possible and not blame everything on Parkinson's or blame everything on the medication, but to also realize that you have two human beings, relationships are complex, people are complex, and the importance of communication generally. And, I know we're going to talk a little bit later about how Parkinson's can inhibit communication and really make it very difficult for the individual to speak, which adds a whole nother layer. But I think generally just the importance of communication between the partners is extremely important. I think, for the longest time, just to go back to when obviously when I met Chad, he had Parkinson's. We were in our 30s at the time. I noticed right away there was a small tremor in his hand, a little bit in his leg, and I kind of put two and two together after the first couple dates that this was probably Parkinson's. And then of course he shared with me that he was diagnosed with Parkinson's after a couple of years of misdiagnosis and other experiments by folks trying to figure out what was actually happening. And I remember at that point, and some of you might appreciate this, I remember saying, I am the world's most impatient person. This is not feasible. I'm not cut out for this challenge because I know how God made me, and I am not a patient person. And I still am not a patient person. I still, I was not radically transformed through, over the last decade to be patient. But, I remember right off the bat saying, this is going to be something that is going to be an issue that we're going to have to deal with, right? I wasn't blinded by those first signs of love to say, we can handle anything. I knew what I was jumping into. But I think that as the disease got to the point, especially when we started to see more off times, where we have seen kind of every flavor of that was talked about. It really doesn't fit neatly into a box. It really certainly has been a challenge for the relationship to really empathize, but then also realize, you have your lives to live, you have your jobs, you have your families, and on top of it all, we are trying to adjust and deal with this disease, which is oftentimes very unpredictable on a day-by-day basis. So, I think communication is key. I think one of the things that we constantly work on is that feeling of comfort of having the person with Parkinson's share what is happening in their mind and explain what's happening to their body as much as they feel that they can. And that is really important from the care partner's perspective, because we are not perfect. We're not mind readers. Many of us have tried our best to learn as much as possible about the disease, to become active in the community where we can see Parkinson's manifesting itself different in different people. But at the end of the day, really making sure that there's a comfort level of sharing, how are you doing today? I mean, is this a bad day? Last night when this happened, help me understand what was going on there, because I don't know exactly what was happening. And really trying to keep those lines of communication open, which is a daily struggle, but really committing to that, I think, is crucial and a really fundamental building block to being on the journey together.
I love how you shared all that. That was full of great points. And I love that you were honest about, you weren't maybe wired to be the most patient person, because there's a lot of people like that out there that are helping their loved one walk along this journey with them in this, and sometimes might beat themselves up for that. I'm interested if you have found that you have come to a place where you have knowing your limitations or your challenges, if you've been able to lower your expectations or change those expectations a bit.
Yeah, it's a great point. And I sometimes struggle with, should I lower my expectations, or do I need to, raise my expectations? That, it's hard, because I don't want Parkinson's. We don't want Parkinson's to completely overtake our lives. And there have been really honest challenges where I've been at my wit's end, where I've said, we have two choices here. One, you can just take your medications and basically sleep all day, and not live your life, or we can figure this out together and move forward and look at things like exercise, which is, I know we sometimes feel like sometimes that can be overemphasized in Parkinson's. I know for a while, when tremors were really bad before DBS, he was exhausted constantly. So the idea of going to boxing classes for 2 hours and all of these other things that other people were able to do just really wasn't feasible. Over time, we've really seen that being involved in things like Rock Steady Boxing and being physically active is absolutely critical. I mean, I notice the difference if it doesn't happen one week compared to if it does happen another. But you're on this journey together, and I think you almost have to mutually set expectations. And it's a constant challenge. It's a constant check-in with each other. I know for me, I constantly feel like I am failing. in many ways. I feel like I'm not patient enough. I feel like I react to the wrong things. I feel like I'm not being that bright shiny star that I should be to constantly make somebody make him happy and to make things easier. And I also know that when I do that and I feel that, I know that that is not positive for him either. So it's something that together you need to figure out where your expectations are, and just try to be as aligned as possible. Because I think if someone has one set of expectations and someone else is at a completely different point, I think that's a recipe for problems.
Right. Oh, you've said so many things that I've heard others share. So I'm glad that you made those comments. We had someone write in, and this goes with our next question for Dr. Agarwal. So David said, diminishing insight in my partner is most difficult. So Dr. Agarwal, people have, said that describing off sometimes can be a challenge if there's communication issues, and that can be complicated by, and I think Greg already mentioned some of those earlier, like terminology, maybe cognitive changes, being able to process and articulate those, speech impairments, things like that can really challenge them. And so I would love it if you could talk about how you've been able to utilize the care partner in assessing, like kind of like Greg has been doing, kind of assessing what's going on, and to be able to help their loved one articulate to you what is going on, so then you can better manage the medications.
So that's a great question. And, the care partner is, can provide more as useful and sometimes even additional information than the person themselves with Parkinson's, because sometimes patients, they're not aware that the tremor is coming back. They're not aware that they are walking and their shoulders are starting to get a little hunched over, or their stride length is becoming slower and they're going more from walking to shuffling. And sometimes people will just say, oh, I see him or her looking a little different. And then I'll say, well, have you taken your meds? So when someone is able to articulate, sometimes the things they'll say is, I just don't feel right. The one that confuses people the most is anxiety. Now, oftentimes when people are wearing off, they'll feel an internal tremor, or they'll feel an internal sense of anxiety. And it's the body is sensing that they're going to transition to an off, and the body doesn't like it. So it kind of activates the fight and flight reaction. And so people will feel a sense of anxiety. If there's a tremor, there's a little fluttery feeling inside. And there's sometimes they'll almost have a sense of impending doom, like something bad's going to happen. And then they'll feel anxious, they'll feel a little jittery. So those can be behavioral things. The motor ones are a little bit more obvious, like the tremor coming back, or the shuffling, or the slow walking. Sometimes there'll just be some extra saliva, because when you're off, you have less spontaneous swallowing. So speech will become a little wet. Or if they're trying to eat, there might be some little harder time eating, harder time cutting food, either because of tremor or lack of dexterity. And then if they're sitting in a chair, they might suddenly, start leaning over to one side. So because Parkinson's affects the body asymmetrically, one side more than the other. And sometimes people will start kind of tilting over to one side. Or if they're walking also, you might notice a little tilt. Or if they're walking, instead of walking in a straight line, they'll sort of start drifting a little bit to one side. So those are some of and then the voice. Sometimes the voice will just become a little bit more softer or raspier. People may find that they can, the care partner might find that they can hear them better when they are on. The speech will become a little softer. And sometimes, just the shoulders going down or the neck flexing forward. All of those are cues. And most people who've lived, together through this journey for several years pick on it quite quickly. So the idea is to educate yourself about this on-off time before it happens. Because sometimes what will happen is, if you don't know the terminology, you don't know this on-off, you can go through a couple of years or several months before everyone realizes what's happening. And especially if that fluttering and anxiety happens, then sometimes people end up going to the ER thinking they're having a panic attack. Or some people will feel a little short of breath when they're anxious, but that could just be an off symptom. So off can manifest itself as like 20 or 30 different symptoms, like the ones we discussed. The clue is, if it happens when the meds are wearing off, you take the next dose, and whatever that symptom is, if it tends to go away, we can be comfortable that it's an off episode. So if the anxious feeling, whatever, goes away after they take their med, we can be a little more assured and not do a huge workup. But say, suppose that thing persists, then you have to think, oh, is it cardiac? Is it something else? So that's also one of the important things of recognizing off episodes, so you don't have unnecessary workup for the other symptoms that present during an off episode.
Fantastic. All right, Greg. So I'm curious, in all of those variety of symptoms that she just expressed, that could be symptoms of off, can you talk a little bit about what your experience has been with Chad? What has he dealt with, and what have been your challenge, if any, to identify them and then share those with your physician?
Yeah, I mean, we have had his movement disorder specialist. Does a good job, I think, of welcoming me for the most part into the conversation. Chad is not someone who, even before, in the early days of Parkinson's, was necessarily going to talk your ear off. And I'm the opposite of that. So, sometimes I have to like really bite my tongue, because she wants to hear from him. She wants to hear his speech. She wants to hear his perspective on things. And so there's many times where I just tell myself, if we're in the doctor's office together, I just need to keep my mouth shut for a little while. But, as was just raised, he, one of the things that, and I should have said this off the bat, is that, in so many ways, Chad is really my hero in terms of how he handles this disease with such amazing grace. He is a very positive person about his ability to manage and, in many sense, conquer this disease, especially after 18 years. He really is remarkable. But sometimes when you're sitting in the doctor's office, he'll have a tendency to paint a very, very rosy picture and not talk about the fact that, many times during the day, he can't walk without falling into a wall to stabilize himself, and really walks from point A to point B to catch himself on the kitchen counter. There's other issues that I see even being brought up in the chat, that are a little bit more personal in nature, that he's kind of hesitant to talk to even his physician about. And so it's important, I think, for us to keep our mouth shut for a while and really let that doctor-patient relationship play out, so that he or she can really get to know and hear from, his own experience. But then, I watch him like a hawk, which is probably not a really healthy thing either. But I know what's going on with his body. I know the on and off times. The one thing that the doctor has done with Chad is really allow him to control his medications. Not to be super prescriptive of, you need to do this at this time and take this many at this time. It's really like, your body best. You've had this disease for a long time. These medications, because unfortunately, we haven't had massive innovative breakthroughs when it comes to medicines in Parkinson's. So it's not like every year we've got 4 new drugs that we're trying to figure out exactly how they work. She really allows him a lot of control over that. So he knows his body, he knows his symptoms, he knows medication. I think he does a pretty good job. Someone mentioned anxiety that I saw pop up in the chat. And that is huge. Just last week, we were having some family photos taken. And wouldn't you know it, just our luck, right when Chad was supposed to sit down in the photo, his meds were off. His leg was tremoring. He could barely walk. Suffice it to say, his photos or his smile in the photos looked a bit forced, which I'm sure those of us who, have loved ones with Parkinson's, they probably don't love having their photo taken because smiling can be very, very difficult, especially at certain times. But that was one of those situations where neither of us are really into having our photos taken to begin with, but to really, have the lights set up and have it be more formal. It was something about that anxiety plus the meds and where they were at that really pushed him over to a very difficult time, which lasted about 45 minutes. We're to the point now where we can kind of laugh about that, because as soon as I saw the difficulty, I said, this is just our luck, right? I mean, the photographer's here, the lights are up, and boom, the disease is where it's at. And so I think we managed to get a couple natural smiles out of it, just, really poking fun at how unpredictable things are. But, it is just extremely, it's hard to watch, from a care partner perspective. I know I sometimes feel guilt for being healthy and for I don't have any chronic diseases. And yet I watch what he's going through on a day-to-day basis, and there's a little bit of guilt that I feel, for that. So, it's one of those things where every situation is going to be really difficult to handle, but you've got to figure out, again, going back to that communication, it's our lives. It's our life together. It's part of our life, whether we want it to be part of our life or not. And we sometimes have to laugh along our strange journey, even during some of these difficult times. I saw someone also put something up about dining and going out for dinner, and that important element of socialization, especially in our society where so much of our sharing is over food, and that we do a lot of that. But we also do it with people who know us very well, and know our journey, and have a level of patience with us when we struggle with some of those things. I know we've had some issues with choking, which are terrifying, but making sure that they're kind of steering away, not micromanaging the diet, and especially when they're out to eat, making sure that you're not choosing their meals for them. But we're lucky to have a good support system that we've really let into our lives, and who are extremely supportive of Chad, extremely supportive of the Parkinson's community, have taken the time to learn about the disease more. And Chad, I think, is a very good educator in terms of answering their questions. And that helps in some of these social situations that are important social situations for us as human beings, but become a little bit more difficult because of the disease.
Wow, you just covered a lot of really great stuff in there that I'm sure a lot of people can relate to. I mean, the guilt factors, we did have someone write in, guilt is huge for them as well. The socialization factor and even your social circle and the importance of that. I'd like to talk a little bit more and unpack that a little bit more, because I know that there are certain symptoms that, and you referenced several of them, that can make it a little more uncomfortable for people to want to go out and be in the public. There's fear of how other people are going to see them. There's a little bit of concern of stigma, that they're watching or judging them. And then, of course, the more anxious they become over those things, then the more symptoms might be pronounced. And so it's like this vicious cycle. So I'd love it, Greg, if you could talk a little bit more about your experiences with handling that, navigating that, and then the impact it has had on you personally. And from a care partner's perspective, maybe their loved one doesn't feel like going out, but the care partner may still need to get out and socialize, and that it's okay for you to have some time where you're doing things for yourself and not going back to guilty about those things. Can you talk a little bit about that experience?
Yeah, and I hope you can hear me. I think my connection's getting a little bit unstable for some reason. But so Chad used to be a rower. And if anyone is familiar with rowing and have rowers in their lives, it's a sport that people are extremely passionate about. And really, it was a huge part of his life for many, many years. He can't do that anymore. He gave it up because of the tremors. And then interestingly, after DBS, he went back and did it for about another 1.5 or 2 years, and actually taught other people with Parkinson's how to row, and started a Learn to Row program through one of our local organizations here. We're big football fans, so we're tailgaters, and there's 100 people at our tailgate party before every home college football game. He doesn't do that anymore, but I still do it. I think it is so important, but yet it's a struggle that I really need to acknowledge, because there are many times where he says, I feel like I'm left behind, but yet it's so difficult for him to go and do some of those things that I really enjoy and really need in terms of my own interaction with my people, which are our people in many sense. But he can't do that anymore. Number one, because it's early in the morning. Number two, the cold is not a friend of people with Parkinson's, especially when you deal with rigidity. There's just the not wanting to be around a lot of people in a crowd. The speech issue is huge for us. It is
Oh, you froze. And you're saying such important things too. I'm hoping your connection gets back on. Give it a second to see if we can.
yes, there's no.
Oh, you came back now you're back. We missed you for a minute. And you were saying such important stuff.
I think I was just saying about the speaking.
Yes.
And
we lost you.
Yeah, and Chad really doesn't like to speak on the phone anymore. So I have to call about the car or the kid's school, or talking to someone about the phone bill or something like that. It is so difficult. And even they can't. So as a care partner, then you've got to feel, and I, again, am not the world's most patient person. So the fact that I've got to jump on the phone and like do all this other stuff, communicating with people, is becoming a larger issue for us. So I think the main point is, again, I think he has gotten to a point where he appreciates the fact that I need certain things in my life in order for me to recharge, in order for me to be me. And he lets me do that now within limitation, but it's, I think we've come to that sort of thing. So I just encourage folks to find those things or rediscover those things that really recharge your batteries and give you an out, so that you don't feel like Parkinson's and all of its unpredictability is suffocating you as a partner. Because if that becomes the case, your ability to be who you need to be for them is really just impossible.
And you touched on a very important point, because you mentioned how, as like the speech, for example, how that's becoming more and more difficult for him to communicate on the phone. So then you're doing more of those types of care activities. You're taking on more of this phone call. So you're taking on a little bit more and adding it to your plate, and a little bit more and adding to that plate. And so over time, that plate starts getting heavier and heavier. The scales tip a little bit heavier on you, a little less on them. So you're getting a little more stressed out because you're not giving up anything, but you're taking on, and they're also stressed because they know it and they don't want that. And just navigating that can cause, lots of frustration on both ends from different views of it, and that can really impact the relationship. It sounds like you have navigated that pretty well. You guys are pretty open in your communication. But if you could share, how have you been able to work through that? Like, I'm sure there's been times when you've struggled with that.
Oh yeah. I mean, thank you for saying that, but boy, it is a struggle for both of us. Again, because I am not, neither of us are perfect, and I think that's the first thing you have to really have to accept. I mean, he's also just going to do what he does. And I can't control everything. And, I constantly worry about his safety. But yet and this is going to probably make some of you, scream, but he'll, like, if he wants to, get the leaves out of the eaves on top of the roof, if his meds are on, he is strapping a blower to the back of his back, climbing up a ladder and getting on the roof. And, outside of me, throwing a temper tantrum and, laying in front of him to stop him from doing it, there's some things that, terrifying, Gisela. Yeah, that's really terrifying. But, there's also a certain part of me that there are certain things that he still can do, and going back to the issue that we're talking about here, during those times where he is on, where he knows that his meds are clicking and he can do it. And, mowing the lawn, things that he's always loved, where my philosophy is more, hey, we can pay someone to do that. We can pay someone to rake the leaves. We can definitely pay someone to get on our roof. So, but those are things that he has always enjoyed. And they're things that when his medicine is working for him, he can still do. And I just have got to the point where I need to be okay with just letting him do that stuff, even if I think it should be handled differently.
So that's a good way to segue to Dr. Agarwal, because it's so important to get to the point where you are managing well the off episodes, so that they do have those good on times and they can do things, not get on the roof, but do some more activities that they would normally hopefully be doing. So Dr. Agarwal, I know that sometimes people sort of feel like their off is an inescapable part of the disease. And obviously we're talking a lot about the quality of life impacts when it's not managed. Can you share how this has been the case? Like, how have you been able to have these conversations with people and help them understand that it may take some work, but but there can be some management with the medications, and maybe then we can go into a little bit about the different types of medications.
So, it's important that in Parkinson's, you never sort of arrive with your meds that, okay, we've figured it out and this is the meds going forward. It's all about fine tuning and reacting to the here, what's happening now, and to some extent projecting and educating oneself about what are the potentials down the line without feeling overwhelmed by it too, because every person doesn't get every PD complication, everyone doesn't get every symptom. So if one starts educating, reading about it, it can sometimes be overwhelming because you think, so this is what's next, this is what's next. So to educate to the extent that you're aware, but not overwhelmed, because again, like I mentioned, everyone doesn't get everything. So when one is educated about these wearing off symptoms and recognizes that, okay, this symptom is a wearing off symptom, and then you bring it up at the next appointment. One, the importance is you don't have unnecessary workup. Two, it is possible to, the motor symptoms in Parkinson's, I know, Greg, you mentioned that it's not that we have earth-shattering medications, but at least the good thing is we do have good meds for motor symptoms. So when there is wearing off, right? Suppose it's wearing off half an hour before. Yes, there are med adjustments you can make with the existing meds we have, or, frankly, most of the new meds that are getting approved for wearing off. So you could either just work with the carbidopa, different formulations of carbidopa, or there are medications you can add on top of the carbidopa that can minimize the off time. So what we try to do is we try asking people about off time early on. Now, at that time, most people don't have off time. So then they'll be confused and they'll say, well, what's off time? But we want to have that conversation then, so that it's not that the people struggle with a year or year and a half worth of off time, and then we are starting to talk about it. So if we start talking about off time before people have, sometimes what happens is people almost feel like they're missing out on something because they're not having off time. They wonder, well, if I am supposed to have it kicking in, wearing off, and I'm not noticing that, maybe my meds aren't working. So then we have to reassure, no, that's not something that you necessarily want to have, but I just want you to be aware that in case you have it, you should let us know. And then, like we discussed, sometimes when that early morning wearing off happens, people initially are taking their last dose of carbidopa at nighttime. Over time, over the years, that might change. So that dose of carbidopa, instead of being at nighttime, may need to be in the middle of the night. So if someone gets up to go to the bathroom in the middle of the night, they could try to take in one dose then. So you've just shifted the last nighttime to middle of the night, and that could take care of the early morning wearing off. You can sometimes switch from immediate release to longer acting formulations. You may need to increase the frequency from maybe 3 times a day to 4 times a day. There are medications that are once a day that you can add on top of the carbidopa that can decrease wearing off. So there are several strategies. The most important is to, keep notice of the symptoms, report back. And probably the most important thing we can do is, say if you go to your, if you're reporting your hypertension and your cholesterol med, right? Cholesterol med may not be that important when you go to your doctor's office to report when you're taking it. Like whether you're taking it at 9 o'clock or 10 o'clock or 11. But for Parkinson's, it's very, very important to kind of track how your symptoms are changing according to the timing of the meds. So it's important if every office visit, people take in a typed or a handwritten note of when they take their Parkinson's meds, like what time of the day, so that when you, and that'll help yourself too, when you talk, say, when someone's taking carbidopa, it's at 9 o'clock and 12 o'clock. And then it keeps turning up that the symptoms are happening at around 11. then it's obvious to everyone it's wearing off. But if we don't have that grid of, when someone's taking meds, it can be hard to pinpoint what symptoms happening due to wearing off, or because it's peak dose dyskinesia, or if someone's having nausea, is it happening because they've just taken their meds? So I can't emphasize enough how important it is to track the symptoms in relation to the timing of the meds. Now, it helps if people have like a typed list, and then anytime you go to the doctor's office and a little change is made, you just go home and tweak that typed list. Some people do write a handwritten list, but it's overwhelming, right? Every time you go to every doctor's office, you're sitting and handwriting it. So if it is possible to generate a typed list on your computer and just modify it every time the change is made, so that when it's time to go, you're just printing off. Now, what happens is sometimes it is hard, people, it's time to go to a doctor's appointment and you find that the, person's off, right? So now suddenly, you're trying to just focus on just actually making it to the appointment on time. And so during that time, you won't be able to write down when, what symptoms happening, when they're taking meds. If in a bind, at least grab the med bottles with you, because we know there's so many formulations of carbidopa, right? There's a 25-100, there's a 10-100, there's the immediate, there's the slow release, there's the Rytary, there's like 25-250. And sometimes it can be confusing who's taking what, and some people are on multiple formulations. So med accuracy, like just reporting when one's taking and the relation of the symptoms in relation to those meds is very, very important.
So I want to go back to clarifying something, because somebody had written in, it sounds like off time pertains exclusively to movement. And that is the one thing that you can more readily track because you can see it. But can you just go back again and maybe just highlight some of the non-motor symptoms that also can be noticeable and is impacted by the medications?
So some non-motor symptoms can be like the speech can get softer, people can get irritable, they can get anxious, they can get panicky, they can get more fatigued, they can get depressed, they can sort of feel off balance. And though that's technically a motor symptom, sometimes dizziness presents with the same off balance feeling. So it's important to kind of figure out if someone's off balance, are they actually off or they're dizzy? Some will have more bladder sort of frequency or urgency during that time, and combined with the fact that they're off and it's harder to get to the bathroom, it can be a problem. And in some, like I mentioned, just increased drooling, trouble swallowing. And then I think I saw a question on the chat box about nausea. So typically, no, nausea is not a wearing off symptom. I just mentioned the nausea because, just the importance of relation with meds of symptoms. Some people will have abdominal pain though as a wearing off symptom. So as the abdominal muscles get tight and their GI system is also sort of turning off for some people, they will have abdominal cramping or tightness. And then when they take their next dose and it kicks in, they'll feel that their crampiness sensation is going away.
And we had a question earlier, and I think now's an appropriate time to ask about the extended release, like Rytary, helping with these OP episodes.
So we know that carbidopa, levodopa is a short-acting medication. So a lot of the challenges we have of this wearing off is because it's a short-acting medication. Now, we know there's carbidopa, levodopa immediate release, and then there is the generic extended release or the controlled release. Now, even with the extended release, you can't change the half-life of the medication. What you're doing is you're trying to just coat the medication layer upon layer so that the layers are sort of slowly dissolving over time, and you're trying to make it last a little bit longer. One of the challenges of taking the generic extended release in the daytime is that if your gut is moving and you're eating and drinking, the absorption and the effect can become a little unpredictable. The controlled generic tends to act better at nighttime. With the right hurry, it's a combination of an immediate and a slow release. So the way the capsule's manufactured, it's made of multiple little beads. And these beads are of different sizes. So when one takes a capsule, you have the smaller beads that will release right away. So people get the immediate effect or the kick like they get from an immediate release. And then the intermediate size beads and the larger size beads, those absorb. So that extends the duration of action. The half-life is still the same, but you've managed, because of that bead technology, to make the effect of the capsule last longer. So you can get about 4 to 6 hours of good benefit from each capsule.
Fantastic. And Greg, I'm going to turn it back to you for just a second as we are coming close to our end of time. So with Chad, how are you guys managing the off now? I know he's had DBS, and I know you've mentioned that you've tried different meds. So how do you feel like he's managing that right now, and how are you doing with that?
Yeah, I mean, I think the tweaking of the medication, obviously for us, DBS was really a game changer, especially for a couple of years after DBS. There was just, really just a much different situation. The tremor still remains relatively controlled, but now I think it's more the gait, balance, speech, some of the things that, from the way I understand it, DBS was really never going to necessarily help. He's very good at managing the medication in terms of off times. I think part of it is routine. Part of it is kind of making sure that, I know that from in the afternoon, there has to be a nap. So I got to figure out the day, and how that's going to work. And we've got a 13-year-old, which is better than when we had a 6-year-old in this regard. But at the end of the day, there's certain things that I think we've just adapted and come into a bit of a routine with. And then just that flexibility. There will be times, just this past weekend, where we can be at a friend's house and he's completely engaged in the conversation, telling stories, very comfortable. And we can be in that same environment the next day and he's not saying a word. It's almost like two totally different experiences. And I think just recognizing that, and again, surrounding yourself and opening yourself up, to a group of friends, to a group of people who are willing to take the time to get to know what it's like to have Parkinson's is very important, because our group of friends that we were with, because they know the journey and have kind of been with us on the journey, didn't really question that. It wasn't a situation where like, what's going on with Chad, and making him feel uncomfortable. Chad, are you okay? Like every 30 minutes. It was more of just an understanding that sometimes this is part of it. And sometimes when his medication isn't working, you do get a different experience with him than you do when his meds are on. So again, being able to continue to socialize, being able to get out of the house, being able to do what you can in a safe space with a small group that gets that, I just can't, I can't overestimate how important that is.
I'm so glad that you shared that. You've given some really good insights, Greg. I really appreciate you sharing your experiences and a little peek into your and Chad's life. I know that. I appreciate hearing that, and I'm sure many do. And I appreciate Dr. Agarwal giving us that perspective from the physician. And I think this was a great conversation for the care partners today to kind of understand, what kind of things they need to be considering and how to have these conversations with the physician. So I thank both of you for that insight. This is National Family Care Partner Month for the entire month of November. And we just want to recognize our care partners because you guys are rock stars. And you do such wonderful things every day. So I want to thank you. I want to thank you, Dr. Agarwal, and I want to thank you, Greg, for coming on and being a part of this conversation, and for everyone that joined in today. And of course, to Amneal for making this program possible today and just being a partner with us for this. So we have a tradition, if you aren't already aware of it, that we have a special way that we like to thank our speakers, and that is our wave of gratitude. And so if everyone would be willing to just share their thanks and gratitude to Dr. Agarwal and to Greg for this conversation today, we'll just give him that wave, and we appreciate you. Thanks for your time, everyone, for joining us, and we will see you all later. Have a great rest of your day.